Good evening everyone. I am Malarvizhi, Assistant Professor, Department of Medical Surgical Nursing. I am going to talk about myocarditis. Introductions of myocarditis. Myocarditis is a disease marked by inflammations of the heart muscles known as the myocardium. The muscular layers of the heart wall. This muscle is responsible for contracting and relaxing to pump blood in and out of the heart and to the rest of the body. Inflammations of myocardium caused by a different infectious and non-infectious trigger. That is the definitions of myocarditis. Myocarditis divided into two types. One is the primary myocarditis, another one is the secondary myocarditis. In primary myocarditis, it's related to the viral infection or autoimmune response to the infection. That infection, it will be spread to the blood vessels and to the myocardium. In secondary myocarditis, inflammation related to a specific organism. Types of myocarditis. There are many types of myocarditis: acute myocarditis, fulminant myocarditis, gain cell myocarditis, chronic active myocarditis, eosinophilic myocarditis, peripartum cardiomyopathy. These are the types of myocarditis. Etiology. Infections such as viral, bacterial, mycotic, parasitic and protozoa, rheumatic fever, immunosuppressive therapy, infective endocarditis. Etiological agents like virus, bacteria, fungi, protozoal, rickettsial and spirochetes infectious. Toxins like tricycline, antidepressants, immunosuppressive therapy, etiopathy, corn disease, excessive productions of immune response, systemic lupus erythematosus. Often it is associated with the pericarditis. Pathophysiology. Due to the viral infection, that viral infections leads to inflammation and injury, scarring of a myocardium. This leads to decreased myocardial contractility, decreased contraction of the heart muscles. This leads to heart enlarge, increase the left atrial pressure, increase the left atrial pressures that will be leads to pulmonary edema. In pulmonary edema leads to a decreased cardiac output and leads to increased sympathetic tone. This leads to congestive heart failure. The heart is not function properly. Phases of myocarditis. There are three phases: acute phase, subacute phase and then chronic phase. In acute myocarditis, 0 to 3 days, viral infection, myocyte damage, myocyte antigens released, cytokines released. In subacute myocarditis, 4 to 14 days, that will be present, cytokine production, infiltrating mononuclear cells, T and B lymphocytes activated, neutralizing the antibodies, viral clearance. In chronic phase, that will be present more days, like 15 to 19 days, fibrosis and cardiac enlargement it will be present. Clinical manifestations. What are the symptoms present with myocarditis? Symptoms based on the extent of myocardium, inflammation and necrosis, fever with tachycardia, fatigue and malaise, myalgia, muscle pain, nausea and vomiting also present, palpitation, dyspnea, decrease in breathing or difficulty in breathing, pharyngitis, inflammations of the pharynx, lymphadenopathy, enlargement of the lymph. Late cardiac signs develop of heart failure, abnormal heart sound, crackle sounds also present, distension of a jugular vein, syncope, peripheral edema will be presence of the angles of foot, angina. Diagnostic investigations like a transient ECG changes like a ST segment flatten, T wave invasion, conduction defects, extrasystole, supraventricular and ventricular ectopic beats. That will be presence of the ECG. When you are taking the ECG, these are the ST segment flattened or T wave invasions also presence in the ECG. You should be confirmations of the myocarditis. Chest X-ray. In chest X-ray show that heart enlargement and lung congestion, and echo detect and qualify the dysfunction, regional valve motion and abnormalities. These are the things it will be shown on the echocardiogram. Computer tomography and magnetic resonance imaging, nuclear scans is also it will be taken for functional abnormalities. Stool and throat culture it also will be taken. And diagnostic evaluation like a endomyocardial biopsy, it will be taken removing the several small tissue percutaneously from the right ventricle with a specific instruments called a biofilm. Coronary angiography rule out other coronary disease. Radionuclide ventriculopathy ventriculography, ejection fraction quantify and valve motion abnormalities. Laboratory testing mild to moderate leukocytosis, elevated level of ESR and cryoreactive protein levels, elevated myocardial markers like CKMP and troponin. Complications like heart failure, the heart is not function, blood clots, valve problems, cardiac arrest and sudden death, it's also presence of complication. Supportive managements like optimal care of arrhythmias and heart failure, adequate rest to take to the patient, administration of the oxygen therapy, restrict the activity, and advice to the patient to take small amount of salt intake to 2 to 3 grams of sodium per day. In medical managements, what are the drugs should be administered for myocarditis like digoxin. This drug to improve the myocardial contractility and reduce the ventricular rate. And diuretic drugs to reduce the fluid volume and decrease the preload. Antiarrhythmic therapy like quinidine and procainamide, no hypotension to give a nitroprazide, beta blockers and amiodarone. To reduce the afterload and improve the cardiac output by reducing the systemic atrial resistance. And immunosuppressive therapy, prednisolone and azathioprine and cyclosporine. In intravenous immunoglobulin therapy, to increase the left ventricular function and improve the survival rate, antiviral agents, rifavirin and alpha interferon. Combination therapy, cyclosporine, muronop, CD3 and corticosteroid, azathioprine. In case of severe heart failure, intra-aortic balloon pump therapy, ventricular assistance device that will be connected to the patient with severe heart failure, cardiac transplantation for progressive heart failure or gain myocarditis and cardiomyopathy, enlargement of the heart. In nursing managements, to reduce the myocardial workload, it focused upon the symptomatic relief, recording vital signs observed the nearly, management of fluid balance, use of Fowler position, provision for quiet environment, reducing the fatigue and educate to the patient and family members. These are the things should be followed for hospital and also home. In complications like heart failure and cardiomyopathy. Acute chest pain related to inflammations of the myocardium. What are the interventions should be followed for patients like a myocarditis? Assess the level of the pain to provide comfort and rest to the patient. Administer the antipyretic to reduce the fever level. Aspirin, digoxin as per physician order they should be administered to the patient. Reduce the physical activity to decrease the cardiac workload of the patient. Decreased cardiac output related to damage of heart muscles. What are the intervention? Auscultating the heart sound, rate and rhythm. Monitor the hemodynamic status of patient. Assess the capillary refill, skin color and temperature also. Assess for jugular vein distension. provide oxygen therapy, to increase the oxygen therapy to promote comfort by relieving the hypoxemia of the patient. Administer the diuretic according to the physician order. Assess for blood pressure. Activity intolerance related to generalized weakness and alteration in oxygen transport secondary to pericardial effusion. What are the interventions given? Like monitor the vital signs during the activity to evaluate the cardiac response, monitor for signs of activity or intolerance, reduce the activity if systolic blood pressure goes down, and plan rest period between activities to reduce the cardiac workload. Thank you.